You as a dental professional may have many aspects of your lifestyle that are causing you pain, discomfort, fatigue, even numbness in your hands. So pinching, grasping on a regular repeated basis. But the good news is there are ways to alleviate these issues, and so I have Dr. Hamann with me to discuss what these can be and give you some more insight into what your symptoms may be caused by.
We learned in my wife and I's dental practice, she's the dentist, I'm the physician, that after she started wearing gloves from Universal Bloodborne Pathogen Guideline back in 88, 87, that she went from not wearing gloves to wearing gloves, and it was one more, I think, variable that caused her hand pain. And she was wearing examination gloves when they started that were made on ambidextrous formers. So it's made to go on either hand. It's kind of like making a shoe that can go on either foot, that it's not foot specific. And that was unusual because in medicine, when it was a procedure that was longer than just a couple of minutes, we would always wear a glove that was made on a former that was hand specific, so that it was a right and left former. And the difference was the fit allows a much, much better circulation of blood and less pressure on the muscles in terms of exacerbation of fatigue. And so I became curious, comparing my wife's problems with what was happening in medicine versus dentistry, and thought that maybe because she was wearing ambidextrous rather than the hand specific, that this was contributing to the pain that she had every night. And so we did some trial and error and actually got surgical gloves. At the time there was not a non-sterile exam glove option, and we were able to significantly minimize her pain by putting her in a glove like a surgeon would wear for a long procedure in a hand-specific half-size intervals. And so she began wearing the surgical gloves and had a significant improvement in her problem. In her case, it was just impinging blood circulation to this thenar eminence because she was wearing a tight glove, holding her in this position, but she wanted to work here so that she would get hypoxic in the ends of her fingers, and that would hurt because of the buildup of lactic acid. So we got very, very interested in creating a non-sterile option to replace this ambidextrous product with a non-sterile option that was hand-specific. And SmartPractice has been very innovative in coming out with that kind of a solution to help with the hand fatigue and exacerbation of pain.
Wonderful. And in addition to the glove options, what can dental workers do in their lifestyle to make sure that these repetitive motions aren't causing some of these symptoms?
One of the other things that could be helpful is these larger diameter instruments that requires less pinch force to work. Also those that have less weight, so that if they are a lighter instrument, that would certainly be something that could help remove some of the, or reduce some of the additional work and effort to do their job. Certainly at home, there's lots of other things that contribute to repetitive motion disorders, whether they're instruments or sports or knitting, lots of things that they need to be careful with that are repetitive motion contributors to what might be causing problems with pain at work. So kind of that work-life balance, make sure that they are not overworking their hands. It's an important asset of theirs in their hobbies, as well as the better hygiene of their hands at work.